Then we will go to clinical tests. Clinical test is first is palpation. Palpation we will do with the finger, with our fingertip. We will palpate the tooth first. Okay, and we will check. Okay, if we have percussion, palpate and percuss it slowly with the with your finger, and check. Okay, if the patient have pain or not. Because directly, if you are trying to percuss it with a mirror handle, if the patient have pain, it will be the response will be too high in initial tapping only, and that can be quite unpleasant for the patient. Okay, so first always try to percuss it with your finger only. Just press it with your finger and check it. Okay, do you have pain? You will say, okay, I have little pain, doctor, but not that much. Then you can try to tap it with your mirror handle. The palpation, we can palpate the tip of the root, or between the root on the outside of the buccal sulcus or the lingual, so that patient can help to localize. Okay, that this is the area where patient is feeling more discomfort. So this is the area where I should concentrate more. I should palpate this. I should palpate or probe this area more, or do the X-ray of this area only. Then there is thermal test, electric test. We'll discuss all this in coming slides. So palpation we have done already. So percussion is two types. Either you can do with a finger or you can do with a mouth mirror. It can be horizontal percussion or a vertical percussion. Horizontal percussion test is positive, and the process, the inflammatory process, it has passed the pulp tissue and it has reached the periradicular area. So at that time, the patient will feel that yes, there is pain on tapping the tooth. It can be also due to an traumatic occlusion, or sinusitis also. Then we have cold test. Cold test, they check the vitality of the pulp. Okay, the response to cold test help to differentiate between inflamed and non-inflamed pulp. That is the reversible and the irreversible pulpitis. Cold test is easy to do, and it's a reproducible test, and you can do easily in your chest side within a few seconds. And cold test generally they excite the A delta fibers, which cause sharp localized pain. A delta fibers, they are generally located in the outer part of the pulp, and C fibers, they are generally located in the core of the pulp. So C fibers, they are responsive. They are responsive when still responsive when there is the necrosis process has already started, because C fibers, they are resistant to oxygen loss also. If the oxygen inside the pulp is less, still the C fibers can survive and they can give positive response on the testing. So so that we can positive or negative response they can give, so that we can reach to our diagnosis is that this pulp is necrotic or inflamed. That's why there is a response or no response. So specificity and sensitivity and sensibility. These are the three terms. Specificity is the ability of the test to detect the absence of the disease. It indicates that the test indicates and helps in identifying the vital teeth. Okay, and then is the sensibility or pulp sensitivity test. Pulp sensitivity test, they help us to estimate the vitality of the tooth or the pulp blood supply of the tooth by the response of the tooth on application of heat and cold. That means by the neural response, we try to estimate or extrapolate the diagnosis that okay, is the pulp vital or not vital? Because if the pulp is completely vital, then due to anoxia, the nerve endings might also be dead. So there will be no response. Means that there is no blood supply also along with nerve supply. And these pulp sensibility tests are thermal test, EPT, and anesthetic test and test cavity test. We will discuss them more. So thermal test, first is the heat test. Heat test is we can apply the hot temperature or rubber compound or a heated burnisher, or currently we can use our thermoplasticized GP guns also can be used to do the testing. But the most important point before doing this kind of testing is first to coat the tooth surface area with a lubricant. Okay, otherwise the compound or the heated GP, it will stick to the tooth only. And if the tooth is still vital and it sticks to the tooth, then it will make the tooth non-vital, because in studies it has been observed that if the temperature of the tooth increases above 10 or 11 degree Celsius, okay, then it can make tooth non-vital, and it can lead to periodontal loss also. That's why it is advisable always when you are doing cavity preparation or any other process, any drilling in the tooth, always to do under copious irrigation or underwater spray to avoid increase generation of sensitive heat. So heat test we have already discussed. Then we will come to now cold test. So what happens in the heat test? The heat application, if it is more than 5 seconds, it causes vasodilation, which causes increased interpulpal pressure and reduces neural excitation threshold. It can lead to positive response, similar to contralateral tooth. That means tooth is healthy. No response means no non-vital tooth. And immediate excruciating pain means pain or response means the tooth is inflamed and irreversible pulpitis is there. So cold test, now we'll discuss the cold test within another slide of the cold test. Now, cold test can be done with different materials like carbon dioxide snow, or now in market it's available as endo ice also, or we can use cold water in the rubber isolation, or we can use TFE now. Tetrafluoroethane is used now because it is more environmental friendly. Cold test is generally done on the buccal surface, buccal two-thirds of the tooth. You can do in the corner surface also, but more advisable on the buccal two-thirds of the tooth. A size 2 pallet of the cotton is taken. It is made fully wet in the refrigerant solution and is placed on the on the control tooth first to check the normal response of the patient. Okay, and then it is placed on the tooth which is in question. So if immediate response is there, which fades out slowly, means the tooth is reversibly damaged, you can do a cavity preparation, remove the caries with a base and restoration. But if the response is too much, which lingers for more time and fades off slowly or doesn't fades off, it means that it's needed root canal treatment. So cold application, no positive response, that means healthy pulp. Short sharp pain that disappears on the removal of stimulus means that is a reversible pulpitis is there. If there is excruciating painful response that lingers after the stimulus is removed, that means there is irreversible pulpitis. No response, that means there is vital pulp. Vital pulp is present. Now, electric pulp test also is not used that much nowadays, as cold test is more frequently available. And studies also have shown that cold test is far more superior in finding out which is the offending tooth than electric pulp test is. So cold test is used more than electric pulp test is nowadays. Positive response indicates vitality, and no response indicate pulp necrosis. So as we are all aware that in the cold test, it is important to complete the circuit either with the lip clip or either the patient touches the hand, touches the probe, and the dentist also has to use one hand without gloves. So it creates a situation where there can be cross contamination from the patient to the dentist, or from the dentist to the patient. So it is nowadays not that much advisable. I think only it is used for the purpose of teaching on the colleges or institutes only. It can give a full positive response also in kind of immature teeth, in kind of calcification, in kind of and calcifications, or when the tooth is multi-rooted tooth, but still only few roots or half of the tooth is non-vital, half of the tooth is vital, then EPT can also give false positive responses. So in this, that's why it is a little bit not that specific, or not that reliable test as compared to cold test. So one more question comes here is that if the patient is coming with a crown, if the patient has a crown and no root canal is there in the tooth, so how to test that tooth? Which test should we use? In that kind of situation, the best test is cold test. We can use the refrigerant spray on the cotton pellet nicely, put on the buccal tooth or the near the cervical area, wait for some time, it will give a response. If no response, the tooth is non-vital or irreversibly inflamed, can do the root canal, can proceed with root canal.